Intermountain Healthcare was founded with the charge to be a model healthcare system. Part of this means driving operational effectiveness. There are 5 guiding operating principles that we adhere to very strongly at Intermountain Healthcare. First, while we're a not-for-profit organization, that should never mean we're not as efficient as for-profit systems. In fact, because we aren't a public company that must always deliver quarterly results that show increases in growth and earnings, arguably we should be able to make better long-term decisions than for-profit systems. So efficiency must be first. Second, we implement best practice in all areas of our organization, not just the clinical areas. What we expect our leaders to do is identify the best practice in their area, determine whether we're achieving that best practice or not. Our expectation in every case is that our leaders will have a written plan to achieve best practice within 5 years. Additionally, if a team can identify a best practice in any area, whether it be finance, patient safety, communications, etc., we share this throughout the system so that we're all on the same page. That leads directly to our third principle. We operate as a truly aligned system with no unnecessary variation and waste. A good example of reducing variations happens every day in areas like purchasing through our supply chain organization. A healthcare system of our size purchases a huge amount of supplies and services every day. We're talking about everything from complex medical equipment to something as simple as a Band-Aid. Now, the example of the Band-Aid is an important one. That's because a few years ago, we were purchasing almost 200 different types of Band-Aids across our system. As you can imagine, much of this variation was driven by personal preference, and we certainly weren't acting like a system in this respect. After careful review and determining the highest quality option for the most appropriate cost, we were able to reduce the number of Band-Aids we purchase from about 200 to 12. Simple changes like this save us a lot of money every year. While this is a very basic example, it illustrates a process we started almost a decade ago. Reducing variation works, and it's the right thing to do for our organization and our patients. Fourth, we invest in research and development, always supported by data and metrics. While this is true in a clinical sense, it's also very important from a process improvement standpoint as well. When I started 12 years ago, the first area we focused on was our supply chain organization. We invested significantly in process improvement, pulling together the areas of purchasing, distribution, logistics, accounts payable, etc. And the payoff has been tremendous, saving the system well over $250 million over the last 10 years, all with much better service levels. Currently, we're investing in research and development in relation to population health. This includes improving people's health and their health care at the lowest sustainable cost. Fifth, and most importantly, we strive to do the right thing always. In my 30 years of experience in almost every case, taking more than a short-term view is also the right business decision. I like to think of Intermountain Healthcare as a forever organization. Unlike many for-profit organizations, we don't have an exit strategy. Our goal is to have a great organization to serve our children's children and their grandchildren well into the future. Following these principles will enable us to do that. If you have more ideas on what principles ensure a great healthcare organization, please share below and subscribe to our Healthy Dialogues channel.